The squint is a misalignment of eyes, which means the eyes are not lined up to look at the same object. So when we see with the right eye, the left eye goes out, and when we see with the left eye, the right eye goes out. So basically there is a misalignment. It is very interesting to know that there are different types of squint. Okay, so it could be the inward squint, it could be an outward squint, it could be up and down. So that is how the squint is basically the misalignment of the eyes with different types, as we just talked about. The squint is caused by n number of factors. So like if we talk about it could run in the family, like the patient's father has, and then the grandfather has. So it has genetic inheritance, so it can runs in the family. Other than that, sometimes squint can be developed due to the injury to the eyes, like trauma or cranial nerve palsies due to the trauma. Other than this, there could be an ocular tumor or the brain tumor which can cause the squinting of the eyes. However, in the recent years during this pandemic, we have seen a lot of patients or children, they are using the smartphones for more than 4 to 6 hours, and then that also leads to the squinting of their eyes, that we call it as the inward deviation, that is esotropia. So smartphone induced strabismus, that is also we have seen the significant number of increase of these patients in our strabismus clinics. Vulnerable to the squint, I think there is no age limit. I mean, there are different types of strabismus. So the squint can happen even in as young as the baby with younger than 1 year, or as older as 80 to 19-year-old elderly patient. So yes, there is no age limit for development of the squint. Squint is correctable at all age. As I said, there is no age limit for the development of squint. At the same time, we can treat the squint at any age. But if you ask me what are the side effects of squint, how the squint affects the patient, so there are many things. So just to talk about, the most important thing is because of the squint we lose the binocular single vision. So the world that we see when both eyes are aligned, that is being disrupted, number one. Number two, our depth perception or the 3D vision is being grossly affected because of the squinting of the eyes. Then number three, to correct or to adapt with that squinting position, these patients, they do an abnormal head posture. So they take an abnormal head posture, which is again cosmetically very disfiguring. Then another important thing is, because of the squint, there is a development of lazy eyes. So the eye who stands squinting for a long duration is at a risk to develop low vision, and that is what we call it as the amblyopia. And the most important again for the in the society, that the people perceive that it cause the cosmetic disfigurement, which has an impact of in their day-to-day life, social interaction, as a social stigma, eye-to-eye contact. So that affects them in a big way. Squint can be tackled at any age, as I was saying. Like I have operated as young as the 7 to 12-month-old patient, and as elderly as 80 to 19 years of age. So there is no age limit for operating the squint. Squint has different option to treat depending upon the cause. So I would say the treatment of the cause is most important. So first thing is to find out the cause and try to treat that cause. For example, we talked about, like, there could be the ocular tumor or brain tumor. So we have to treat those causes first, and then we can think to treat the squint or a strabismus. So the first step is correction of the spectacles. So many type of squint that can be tackled just by giving the glass. So like high plus glasses or high minus glasses, they would take care of the small to moderate amount of squints. However, majority of the squints, they can be tackled by doing the surgical intervention. So those surgical interventions could be in one eye, doing two muscles, or even in both eyes, doing more than two muscles, like three or four muscles, depending upon, how much severe is the squint, like how much inward the eye has moved or how much outward the eye has moved. So depending upon that, we as a strabismus surgeon take that call whether the patient needs, the one eye surgery or two eye surgeries. The benefit from the squint surgery is almost more than 90% of the patients, they do benefit in terms of recovering their binocular single visual field, depth perception. Then we can help them to improve the vision by alignment of the eyes, followed by treating them for the amblyopia therapy. So that definitely helps. And at last, the most important thing is they get a new life by a good alignment with a good cosmetic appearance, which makes their world completely different. That brings back their the social confidence, those the social stigmas, eye to eye contact, interaction with the peers. So that makes the huge difference in their life. I mean, the sole way of doing exercise and getting rid of the squint? No. However, the scientific way of doing certain exercises, that what we as a strabismologist advise in an orthoptics clinic, either before surgery or after surgery, that those exercises definitely helps to align or to make the eyes straight or to correct the squint. It's not about right age. I mean, as we talked about, so age is not a bar at all. However, the complications, I would say more than 95% of the time, the squint surgery is very safe. I would say this is why, because the squint surgery is an extraocular surgery. It's not an intraocular surgery. So we as a squint surgeon don't need to go inside the eye, or there is no risk of like infection or retinal detachment or losing the vision per se. This is an extraocular surgery which needs the adjustment of the muscles from its natural position by using the very safe sutures. So after surgery, there would be one or two few sutures which automatically get absorbed, and then we need to put some antibiotic and steroid drops in a systematic manner, and then that would take care of the post-operative inflammation, redness or watering of the eyes. I just wanted to make aware that in our society, that all of us should be aware that the squint is a very much treatable problem. If you talk about the Indian context, almost 5 to 7% of all the ocular problems, the strabismus is contributing this much. So I think we need to make a big change by this awareness program, that yes, the squint is very much treatable and we can make a big difference the patient's life or people's life by making their eyes straight, by performing the strabismus surgery or the medical treatment as appropriate.